Welcome back, my dear friends. Good morning, all of you. Welcome to my channel. And today we are going to discuss about the anterior triangles of the neck. So far, we have discussed about so many triangles. So, we have seen the triangles in abdomen. There are Calot's triangle. We have seen. Then we have seen the lumbosacral triangle of Marsili. We have seen lumbar triangle. We have seen, and we have seen the femoral triangle. And now we have come to the neck region. There we can identify two major triangles. One is posterior triangle. Next one is anterior triangle. So in the anterior triangle, we can identify there are four subdivisions of triangles. In one triangle, there are four subdivisions of triangles. So we are calling it as anterior triangles of the neck. So before going to explore this, please subscribe to my channel. So before we are going to understand the anterior triangles of the neck, every one of us have to understand what are the midline structures present at the neck. So to understand the anterior triangles of the neck, every one of us have to understand what are the structures present at the midline. So where we are drawing the midline. So the midline we are drawing at the neck from the lower border of the body of the mandible to the jugular notch or suprasternal notch. So this line, midline, which is forming the base of anterior triangle. Okay, so the midline is forming the base of anterior triangles of the neck. Okay, so we need to understand what are the structures present at the midline. So let me explain first what are the structures present at the midline from symphysis menti to the jugular notch. So the first one is we can identify the symphysis menti, which is the lower border of the body of the mandible at the midline. Then just below this symphysis menti, we can identify fibrous raphe, which is formed by the right and left mylohyoid muscles. Then after that, we can identify below the mylohyoid raphe, we can identify the hyoid bone body of the hyoid bone. This is the body of the hyoid bone. Then after that, you can see the upper border of the thyroid cartilage. Upper border of the thyroid cartilage. There is suprathyroid notch or superior thyroid notch. So between the hyoid bone and the superior thyroid notch and entire the superior border of this thyroid cartilage, we can identify a membrane that is called a superior thyrohyoid membrane. So that is also present between the hyoid bone and the superior border of the body of superior border of the lamina of thyroid cartilage. Then below that we can identify right and left laminae of the thyroid cartilages. They are going to join with each other at the midline and they form the laryngeal prominence or Adam's apple or angle of thyroid cartilage. Okay, there are three names of that. You can remember anything. One is angle of the thyroid cartilage. It is also called as Adam's apple, or it is also called as laryngeal prominence. Then below that we can identify the median cricothyroid ligament. Median cricothyroid ligament, which is present between anterior arch of the cricoid cartilage and the lower border of the thyroid cartilage. Then below that you can identify the cricoid cartilage. Then below the cricoid cartilage you can identify the first tracheal ring. Then after that, we can identify the isthmus of thyroid gland, where we can identify the right and left lateral lobes, which are going to join with each other at the midline. That particular junction part is called as isthmus of thyroid gland. Then below that, we can identify inferior thyroid veins. Inferior thyroid veins, they are going to join with each other and forms the jugular venous arch. Jugular venous arch. Then below that, we can see the suprasternal notch or jugular notch. So these are all the structures which are present at the midline. They are forming the base of anterior triangle of the neck. Then let us discuss about what is present above and what is present below. Now in this picture, once again we try to see this midline, and above it is formed by the lower border of the body of the mandible and the lower border of the ramus of mandible and also the gonion or angle of the mandible. That is forming the superior boundary. Then the inferior boundary is formed by anterior border of sternocleidomastoid muscle. Anterior border of sternocleidomastoid muscle. Let me show you that anterior border of sternocleidomastoid muscle on the picture. Yes, here you can identify this is the anterior border of sternocleidomastoid muscle, which is forming the lower boundary of the anterior triangles of the neck. So the triangular gap between the two heads of the sternocleidomastoid muscle, that is called as lesser suprascapular fossa. It is containing the terminal part of internal jugular vein, which can be entered at the side by needle or a catheter. Remember this clinical aspect of this interval between the two heads of sternocleidomastoid. Then in this picture, we can identify clearly the anterior border of sternocleidomastoid and lower border of the body of the mandible and lower border of ramus of mandible. And this point is called as gonion or angle of mandible. That angle is present between the body and the ramus of mandible. Ramus of mandible, posterior border of ramus of mandible, we can identify this gonion. And midline structures, already there I told you about it. It is forming the base of anterior triangles of the neck. Now, can you see clearly? This is how the anterior triangle of the neck is formed. Now, we are going to see the subdivisions of this anterior triangle, subdivisions of this anterior triangle of the neck. So, this is how we can see that anterior triangle. Then the subdivisions are, there are four subtriangles are there. One is digastric triangle. Then medial to this is the submental triangle. Below medially, we can identify the muscular triangle. Below and lateral, it is carotid triangle. Carotid triangle. Let me show you how the four triangles are going to form. So here you can see that superior boundary, inferior boundary, base and apex is which is projecting posteriorly. Here you can see this is a triangle called as a digastric triangle, and then this is the submental triangle. And here you can see the inferolateral, you can see the carotid triangle. Inferomedially, it is formed by the muscular triangle. So on the picture, how we can see that. So this is how the anterior triangle is present. And now let me show you the four subtriangles. So this is the hyoid bone, and here you can see the digastric triangle which is present between anterior belly of digastric and the posterior belly of digastric, and the base is formed by the lower border of the body of mandible and lower border of ramus of mandible. So this triangle is called as digastric triangle. Then this yellow color one, which is forming the submental triangle, the base is formed by the hyoid bone, and lateral boundary is formed by anterior belly of digastric. Medial boundary is formed by the midline, which is extending from symphysis mentae to the hyoid bone, that is the median fibrous raphe of mylohyoid muscle. Then another triangle is carotid triangle, which is present inferolaterally. The base is formed by superior belly of omohyoid, superior boundary is formed by posterior belly of digastric, and posterior boundary is formed by anterior border of sternocleidomastoid muscle, So in this three boundaries, you can identify this is the carotid triangle where the important structures are present. The next triangle is muscular triangle. The base is formed by the midline structures which are extending from the hyoid bone to the suprasternal notch, and anterolateral boundary, superolateral boundary is formed by superior belly of omohyoid. Inferolateral boundary is formed by the remaining anterior border of sternocleidomastoid muscle, So between these three boundaries, you can identify this triangle is called as muscular triangle. So in the digastric triangle, you can identify, we can see the submandibular salivary gland and some important structures we are going to identify. And then this submental triangle, which is consisting of submental group of lymph nodes, carotid triangle, which is consisting of the common carotid artery, external and internal carotid arteries, and the internal jugular vein, and the vagus nerve is also present. Then the muscular triangle, which is consisting of all the muscles, strap muscles, which are present extending from the sternum to the thyroid cartilage and sternum to the hyoid bone. So this triangle is called as a muscular triangle, which is consisting of muscles. Okay, so that is about the four subdivisions of anterior triangles of the neck. Remember the names. So this is submental triangle, submandibular triangle, it is also called as digastric triangle, carotid triangle, then the muscular triangle. So these are the four subdivisions of anterior triangles of the neck. Yes, let us see on the cadaver. Let us see on the cadaver how the anterior triangles were present here. So here we are observing from the lateral view. We have just turned the cadaver's neck to the opposite side. So we can identify here is the chin, and these are the midline structures of the neck we can identify. And this is nothing but the here at this level you can see the sternocleidomastoid muscle, and this is the anterior border of sternocleidomastoid. And here you can see the mandible, lower border of the body of the mandible, and posteriorly you can see the ramus of the mandible. So between these boundaries you can see the anterior triangle of the neck is present. Now let us see what are the structures forming the roof of anterior triangles of the neck. So anterior triangles of the neck, the roof is formed by from outside to inside. The first one is skin, where we can identify in the upper part we can see the hair follicles which are forming the beard. Then lower part we can see it is a plain. Some people you may see the hair follicles also present at the lower part of the neck as well. Then below the skin what is present? Let us see. So below the skin we can identify the subcutaneous muscle called as platysma. Subcutaneous muscle called as platysma. It is extending from the lower border of the body of the mandible. It is extending down and enters into the thorax and to the shoulder region. So you can see the fibers which are extending down and reaching down to the pectoral region and down laterally to the shoulder region. Okay, so after separating this subcutaneous muscle platysma, we can see the white color fascia called as investing layer of deep cervical fascia. Investing layer of deep cervical fascia, and here it is going to split and covers the sternocleidomastoid muscle. So we can see underneath the platysma investing layer of deep cervical fascia. Then after separating that investing layer of deep cervical fascia, we can see clearly the sternocleidomastoid muscle. Sternocleidomastoid. And this is in this area we can identify the anterior triangles of the neck. So blindly you remember in front of sternocleidomastoid that is called as anterior triangles, behind the sternocleidomastoid muscle that is a posterior triangle. So in front of sternocleidomastoid that is anterior triangle, behind the sternocleidomastoid that is posterior triangle of the neck. Now we have just reflected the sternocleidomastoid muscle also, and we can identify clearly in the upper part we can identify a gland which is present in the digastric triangle called as submandibular salivary gland, and below that we can see this is a hyoid bone, and this oblique muscle is called as superior belly of omohyoid. Superior belly of omohyoid. This superior belly of omohyoid is separating the lower part of the anterior triangles into two subtriangles. Medial to this superior belly of omohyoid, this triangle is called as muscular triangle. Lateral to the superior belly of omohyoid, this triangle is called as a carotid triangle. Carotid triangle. Now in this picture, we can identify two more triangles which are present above the hyoid bone. Above the hyoid bone, between the two bellies of digastric, this is the submandibular salivary gland which is present in the digastric triangle. Medial to the anterior belly of digastric, this triangle is called as submental triangle. So here you can see the lymph nodes are present, that is called as submental group of lymph nodes are present in the submental triangle. So in detail about the four subtriangles we are going to have another class. So till then, see you dear friends. Thank you.